Good afternoon, everyone. I'm thrilled to welcome you to Healthy Living Together. Today, we're honoring September as Suicide Awareness Month, and I'm very pleased to be able to offer this program with partnership from Community Mental Health. Your microphone is automatically muted. At the bottom of your page, you will see a question and answer function. Please just click on that if you would like to ask a question, and we'll bring it forward to our guest speaker today. And then this program is being recorded and will be available later on YouTube. And Nina Barnett will email you that link. Our speaker today is the ever energetic Kellie Phelps from Sanilac County Community Mental Health. She works in prevention and public relations with Community Mental Health. She is the chair of the Sanilac County Prevention Network, and she is a certified trainer for question, persuade, refer, and mental health first aid. So at this time, I'm very thrilled to turn our presentation over to Kellie Phelps, supporting your friends and family in suicide prevention. Kellie?
Hi, Louise. Thank you so much, and good afternoon, everybody. Before we get started, I just want to take a moment to thank McKenzie Hospital and their Healthy Living Together program, and Louise and Nina for inviting me to come back and share this important information with you, particularly during this month, which, as Louise mentioned, is Suicide Awareness Month. Earlier, in the summer, starting in about August, we started putting out our displays around the county that represent the lives lost to suicide in Sanilac County over the last 10 years. They were out in Sandusky, where we had them on the courthouse lawn. We had it in Minden City, where we had our signs represented, and in Deckerville, and also out in Lexington. So we thank all those partners for allowing that and for us to raise awareness of the issue of suicide with those displays. We've been very busy, and when I say me, Sanilac County Community Mental Health and its partners of the Sanilac County Prevention Network, with raising awareness, trying to spread information of available services within our county, and of course, efforts going on at the state and local level to prevent suicide. So we've been on the radio, we've highlighted youth suicide and resources available there, adults and suicide, particularly in men, as men represent the highest portion of deaths by suicide. And for our veterans die at a rate about 1.5 times more than any other population subsection. So there's a lot of efforts going on to reduce and end suicide in the military population for veterans and their families. On September 11th, we had our Suicide Awareness and Remembrance Walk. That was an extremely meaningful time. I hope that all the participants came away with that sense of renewed hope. Lisa Claver of Kirsten's Ride in Jordan, Michigan, came down and shared her story and just provided a time of hope and encouragement and just providing her insights into how her family found new purpose after the loss of their daughter. We're very grateful for that. Our walk this year is our main fundraiser, And the Sanilac County Prevention Network voted earlier in the year to dedicate all funds raised to the Derek Puff Face Transplant Fund. And if you haven't heard of Derek before, he's a young man from Huron County who was a nursing student back in 2014, and he attempted to die by suicide. Now, many years later, Derek is a candidate for a face transplant, and he and his family are trying to raise money to cover not only the cost of the surgery, but the therapies that have to follow for many years after that. So if you weren't able to come out to our walk or to purchase a t-shirt, there are still t-shirts available. You can still make a donation. And our website, which we can put in the chat for that, is https://stopsuicidenow.myevent.org. So we have through the end of the month to continue to raise funds for this young man. So let's go ahead and get started with our training. So today's training is about suicide awareness. And we're going to speak to preventing suicide, generally, primarily in the adult population, but we'll touch on a little bit of information for youth as well. And then after the training, I have some additional resources that I'd like to share with you. Okay, so shedding light on the issue of suicide. What we're going to talk about today are the rates in the US and Michigan, why suicide happens. We're going to kind of debunk some of the myths around suicide, and how we can help someone experiencing a mental health or a suicide crisis. And then, as I said, we'll have some information on resources and further trainings that you can take to learn more about mental health issues and supporting those who may be experiencing a crisis. Our next slide. So let's take a look at some of the rates in the US for 2019. I take all of my numbers directly from the CDC or the American Foundation for Suicide Prevention, because they're better at navigating the whiskers system where you can run all these statistics than I am. So I appreciate their work. We had some good news in 2019. And as you see, the national statistics, they do run a couple of years behind because they're very careful about searching, of course, the death records to ensure that their numbers are as accurate as possible. But the numbers dropped from over 48,000 to 47,511. However, this still does represent an increase of suicide rates of about 35% since 1999. Where the death rate per 100,000 was only 10.5, but now is up to 13.9 per 100,000. And when you see in this presentation those decimal numbers, it's because suicide rates are generally measured in deaths per 100,000, so that in any given population, that measure is equal. So we know that men represent the largest portion of death by suicides in the US, and it's about 3.6 times higher than women. However, women attempted about 1.66 times more often than males. And excuse me, it's worth mentioning that there is a closing of the gap there over the last few years. We were right at males being 4% higher in deaths than females, but females attempting about 3.5 times more often than males. So you know, it appears that we're seeing a little closing of the gap of the number of deaths of women per attempts. And overall, there's about 25 attempts per death by suicide. And that number fluctuates depending on the age range that you're referring to. So this all means that there's about 130 deaths per day by suicide, which is still about the equivalent of a major plane crash every day. Just imagine that making the news. Go ahead and go to the next slide, please. These numbers here are from 2018. And I couldn't find a 2019 scale like this, and I kind of like the way this is laid out. So I wanted to leave that up to here so that you could see the differences in deaths by race. One thing that we know about the deaths by suicide in 2019 is that for whites, the death rate decreased. However, for Blacks or African Americans, it actually increased slightly. So, we are becoming much more aware of the disparities in health and access to medical and mental health. And I think that it's just worth mentioning to keep in the forefront of our minds that while there was a decrease in deaths in some areas, there were not in others, and that's particularly in minority populations. Research is still ongoing as to the overall reason for the decrease, but no real clear answers have been concluded yet, and hopefully we'll know more soon. Okay, next slide. All right. So in Michigan, Michigan deaths were down also in 2019. So we were at about 14.2 per 100,000. And that made suicide the overall 10th leading cause of death. It is the second leading cause of death for 10 to 34-year-olds. If you were to go to the Whisker system, the CDC, and change those numbers to about 10 to 18 years old, it would be the first leading cause of death in Michigan, according to the Jason Foundation. I'm sorry, it's the fourth leading cause of death for those ages 35 to 44, and the fifth for those ages 45 to 54. Overall, for those 64 and older, it's the 17th leading cause of death. I will note that as the 8th leading cause of death for those 55 to 64, that is an increase for that age range from previous years. Next slide, please. Okay, so there are some myths surrounding the issue of suicide, and we're going to kind of debunk these, and you can go ahead and put all of those up if you like. So the first one, oftentimes people may think that suicide is inevitable, but the fact is if people get help, they may never be suicidal again. Another myth is that talking to someone about suicide or asking them if they are having thoughts of suicide will make them angry and increase the risk of suicide. But actually asking somebody about suicide may lower their anxiety level and actually give them a flood of relief that they have someone that they can talk to, and it lowers the risk of an impulsive act. If someone is not thinking about suicide, you're not going to put it in their mind just by talking to them or asking them the question. Another myth is that only experts can stop suicide, but that is a myth. This training that we're doing today is kind of generalized as what we would call a gatekeeper training. Gatekeepers are people who take the time to learn the warning signs, the risk factors, and how to have a conversation with somebody and connect them with help if that person's experiencing a suicide crisis. And study after study after study shows that the more trained gatekeepers we have, the more suicides are averted. So you can feel really good about your efforts today. The QPR module designed by Dr. Paul Quinnett has a really cool slide on it. They explain that each of us has about 160 people in close proximity to us in our lives. And I kind of guess that in our small rural area, that number is probably higher. And so if you put all those dots on a page and in the middle you put another dot that represents a person in crisis, the more of those peripheral dots are people that are trained in gatekeeper trainings, the more likely that an intervention is going to occur and a life is going to be saved. Okay, go ahead and go to the next slide, please. Where am I? Oh, there we go. So suicidal people keep their plans to themselves. You know, on occasion, on rare occasion, that is probably true. That does happen. But by and large, the majority of the people who experience a suicide crisis or thoughts of suicide have given a verbal indication to somebody in their lives. Unfortunately, that's not always a direct statement. Sometimes the statements are kind of veiled, and we're going to look at what that might mean so that you as a gatekeeper can better identify when a suicide crisis may be happening in the background. Another myth is that if you talk about it, you're not serious. And that also is false, that people who talk about suicide may attempt an act of self-destruction, and any talk of suicide should be followed up with immediately. Okay. Once a person decides, there's nothing anyone can do to stop them. By and large, that is false. Suicide's complex. It doesn't happen in a vacuum. No one issue really causes suicide for the most part. But when someone has thought about suicide, it is often a permanent solution to a temporary problem. And what that may look like is, and just the person's inability to find any type of solution or see any path forward. And that's an indication of hopelessness having set in. So any type of action that you may take to help someone live and not die will be received as a positive action. Okay, go to the next slide, please. So we're going to look at why suicide happens. And as I mentioned, it is a complex issue, generally brought on by a combination of factors. And most people will give some sort of warning signs or clues, whether they be direct or veiled. Shame, helplessness, hopelessness, and despair are major indications of a potential suicide crisis. Having a mental health disorder, particularly untreated and untreated depression, mental health disorders have been found to be present in about 90% of deaths by suicide. Research as to the causes of suicide are ongoing. There's just all kinds of research being done in thinking genetics. The impacts of trauma particularly are at the forefront right now. Treatment and prevention. And at this point, I just want to mention really quickly, I want to give kudos to the state of Michigan overall, because there are several concerted initiatives going on at the state level, including the Michigan Suicide Prevention Commission, that is looking at developing suicide prevention plans at the state level for all populations. There's the Transforming Youth Suicide Prevention, which is already very active in establishing zero suicide emergency departments, and the Michigan Veterans Affairs Association is working hard to prevent suicide in our veterans, including lethal means in controls, excuse me, and helping to connect our veterans to their earned benefits as they exit the military and also exit in a time of incarceration. So they're just doing a fabulous job. There's also the Preventing Suicide in Michigan Men, PRISM, who are working to lower the suicide rates in men. There are some local resources that we'll touch on later as well. You can go on to the next slide. Thank you. So let's talk about some of those risk factors. We talked about having a mental health condition, particularly those that are untreated, and sometimes persons who develop a mental health challenge will go as long as 10 years without treatment, just exasperating their symptoms. Having chronic physical health condition, including chronic pain, a previous suicide attempt, about 25% of attempters will attempt again, although most people go on with appropriate treatment to never be suicidal again. Losing a friend, loved one, or maybe a famous, admired person to suicide, that suicide contagion tends to come into play. Loss of a relationship, maybe through rejection or death. A history of trauma, maybe childhood abuse, neglect, PTSD from wartime trauma, an accident, being the victim of a crime, and having a substance use disorder. Substance use disorder and mental health conditions often co-occur together. And there could be loss of job, financial security, a business failing. You can go on to the next slide for me. These are just some of the reasons, so I want you to keep that in mind as we go through it. These are some of the major indicators that a suicide crisis may be building. So some warning signs, maybe talking about wanting to die or wanting to kill themselves directly. Talking about feeling empty, hopeless, having no reason to live. One of the things that sometimes occurs, particularly with depression, is that a person's thinking can be restricted, can begin to constrict, and the problem-solving skills are lessened. So maybe somebody can't see a way forward when there is a way. And our job as gatekeepers is to help to restore that hope in a person and give them a reason to live and to not die as we connect them with appropriate professional help. So, a person may be planning or looking for a way to die, maybe searching online, stockpiling pills, acquiring a gun. It's important to note that in Michigan, by far the most often used means are firearms. So we will touch on controlling access to lethal means a little bit later on, okay? Let's go ahead and go on to the next slide about warning signs. So a person may be talking about feeling great guilt or shame, feeling trapped, or feeling that there are no solutions to their problems. Again, that helplessness and hopelessness that set in, feeling that unbearable pain. We recognize that people don't really want to die. They really just want their pain to end. And so our goal is to begin to instill that hope to help them see a way forward. They may talk about being a burden to others and increased use of drugs or alcohol, behave anxiously or agitated. Go on to the next slide. Withdrawing from friends and family. So in the wake and unfortunately still in the midst of the COVID-19 pandemic, I just wanted to touch upon the withdrawing a little bit. Studies show that in times when societies must lock down and separate themselves, and people separate themselves from one another, at the ends of that time of isolation, there will be a segment of persons who will have an extremely difficult time reconnecting socially as they once did prior to the crisis. And we are already seeing some of the effects of that. Also short.
Kellie, that is one of our questions in the question box. Have it nationally, is there an increase in suicide among adults or adolescents during this COVID pandemic?
So what we're seeing, and these are short-term studies, but they're being done often, is that we're seeing absolute spikes and increases in depression and anxiety, exacerbations of other mental health issues, increases in substance use, and also reports from the CDC this summer indicate that across the country, there have been spikes in emergency room visits by youth with suspected suicide attempts and self-harm. Some states are reporting 2020 preliminary numbers that are showing higher rates of suicide in youth. Now, even with that said, it's a very important to understand that final numbers in that we won't really have for a little while. And that's again because that diligence that we have in researching the death certificates and coalescing all of that information, and also because of differences in reporting of deaths from state to state when it comes to suicide. We don't have a consistent system yet for suicides, and that's one of the many things that we need to work on in our suicide prevention efforts, not only in the state, but across the country. So I like to speak in hopeful terms because of the thus far overall in what they've seen and research, the numbers have not spiked yet. And my hopefulness is that with all of the awareness that we have, and with new funds being funneled into mental health and suicide prevention at the federal and state levels, that we are prepared enough to be able to reach out and to help our friends and neighbors to keep suicides from happening. So we don't have final numbers yet, but hopefully we won't see the worst. Does that answer your question? Thank you. All right. Okay. All right. So let's see. Okay. So the withdrawing from family and friends. At this point in time, it's more important than ever that if we notice a friend, a family member, a neighbor who seems to be isolating more, and not re-engaging in activities that they enjoy, that we reach out to them. Show up with some tea and cookies, invite them to sit outside while the weather's still nice. If they don't want to be inside and closed in, make a phone call. Social media has really helped many, many people during this time. But, me personally, we just need people. We need each other. We are pack people. We are not intended to be alone and to be isolated. So hearing somebody's voice, seeing their face just makes all the difference in the world. So that's just something to think about and to be aware of. Okay, so other warning signs that we may see: giving away prized possessions, the saying of goodbyes, and putting affairs in order. So the more warning signs and risk factors, the greater the risk of a suicide crisis. All right, let's move on and to our next slide. So reaching out to somebody who you just want to check in on, or you're concerned about, may be experiencing a crisis. So you want to make sure that you pick a quiet, private place to have a conversation, and that you have the time to do so. It's very important that you have distractions are put aside. Turn off that cell phone. You want to sit comfortably across, maybe next to them rather than across, using comfortable eye contact, and listening patiently and show empathy. So how we can do that is really using those active listening skills and listening non-judgmentally. Everybody needs to be seen and heard. And when someone begins to share with us the concerns of their heart or what's going on in their lives, what we can do is receive, just understand, ask questions for clarity, not be too quick to jump to or rush to judgment, or tell them what they need to do. And definitely we don't want to hijack their story by sharing a similar experience until it seems more appropriate and we know that they've been heard, if at all. And most times I find that's really not an appropriate thing to do. So you'll want to use your I statements. I'm concerned about you and I care about you. I've noticed that you haven't been coming to, things like that, so that the person knows that you are with them, that you are on their side. You want to keep your tone of voice low and be calm, and never threaten, push, or respond in fear if somebody makes a statement about wanting to die. So let's take a look now about how to ask the question. Go ahead and go to the next slide. Oh, I'm so sorry. I duplicated the slide. There we go. I was doing some updates this morning. So when you are reaching out, the first thing you're going to want to do is make sure that you have your local resources, and address resistance to help. Sometimes people may have had a bad experience with 911 or at a hospital. And while you can't always speak to every concern, you can reassure them that you're going to be there with them every step of the way. And you're going to want to provide options to them. And we have another slide coming up that has our local resources for crisis situations. Let them choose which avenue you're going to take to get help. Help them to identify people in their lives who maybe have been supportive of them in the past, or they would just like them to be with them during this time. It could be a spouse, a pastor, a therapist, and never agree to keep suicidal thoughts or plans a secret, and never leave a suicidal person alone. Okay, go ahead and go to the next slide. Here are our National Suicide Prevention Lifeline. That number will be changing soon, but this number will be valid for a long time. They will forward it, but the number is going to change to 988 sometime next summer. But that's a talk line where you can call and ask for help. Sorry, puppy made a noise. The crisis text line, if someone isn't comfortable with talking on the phone, the crisis text line is the 741-741. And Sanilac Community Mental Health has a local crisis hotline that you can call 24/7, the 888-225-4447. Additionally, during the day in Sanilac County, Monday through Friday, if you or a loved one would like to speak to a crisis counselor in person, you can just walk right into one of our lobbies and we have a crisis worker available every day. They could go to the nearest emergency room or call 911. Now, 911 is generally my last option. And let me just tell you why. Because it can be frightening for a person to have an ambulance show up or police officers to show up. But I also want to assure you that if it comes to that, if the person you're speaking with is definitely thinking about suicide, you can say, I want you to live and not die. And if we don't go with one of these other options, we're going to need to call 911. All of the sheriffs in Sanilac County have been trained in mental health first aid and crisis services intervention. Also, many of our local police officers have been trained. I see them all the time in our classes. So you can be very assured that our local law enforcement have the best training that we can provide them locally to handle a crisis intervention. Now, before we go on, I'd like to take a moment to just kind of back up to ensure that we don't miss something to the thought of asking the question. There are some things that I would like for you to keep in mind when you're asking the question in a conversation. So you've heard some things that have concerned you. You're concerned that there could be a suicide crisis developing, and you're just feeling that sense of urgency. Even if you're not sure, I want to encourage you to not ignore that little voice inside you that says that I need to ask the question. But before you do, it's very important that you're prepared in your heart and mind for what the answer may be. It can be very, very jolting to hear a yes to that question. So we're going to take a moment virtually here to stop, and you can stay muted, but I would like you to look right at your screens, at your camera. Take a deep breath and clear. Exhale. And then we're going to ask the question, and you can ask it however you feel most comfortable. You can say, are you thinking about suicide? Or are you thinking about killing yourself? Or are you planning on taking your life? Okay, so let's go ahead and do that, and I'll give you just a few seconds. Are you thinking about killing yourself? Okay, shake that off a little bit and just think for a moment about how it felt to say those words. It's very important that you are prepared for that, because you have to work on not responding in a negative way. When we respond negatively, that means that we're expressing our shock. You can't do that. You can't be thinking of that. That's a stupid idea. You have to be able to receive what they are sharing with you. So you're just simply going to receive it and say, Okay. And have a follow-up question. Do you have a plan? And do you have what you need to carry out that plan? These types of questions will help to inform crisis and emergency personnel later on. Are there any questions in the chat, Louise?
Nothing further right now. Thank you for asking.
Okay. All right. Let's go ahead and then go on to the next slide, if you would. So here are the upcoming training that I wanted to share with you, which I believe is rather timely in light of the increase in suicidal ideation and attempts amongst our young people. Harbor Oaks Hospital and Sanilac County Community Mental Health partnered in the past to offer the Jason Foundation's I Will Not Be Silent Youth Suicide Prevention presentation. This is a free training and it only takes an hour of your time, and that is on September 21st. It is via Zoom. And you can register for that. I don't know if that link can be shared, but if it can't, you can put in my email address at prevention@sanilacCMH.org. Just indicate to me that you would like to take that training, and I'll get you signed up for it. Okay. So go ahead and go to the next slide for me. This is just some of the fabulous local resources that we have. These are provided by the Thumb Community Health Partnership, which is a regional entity working to reduce suicide and to improve health in women. And let me just state that your physical health is absolutely connected to your mental health, and that mental health issues can be just as impactful as physical health issues. So two of the major resources right now that the Community Health Partnership has put out there is, well, first one is Man Therapy. They have a website, mantherapy.org. You can go there, and you, being any man or woman, a man can take a health, what they call it, a 4-point or 7-point head inspection, where you can take a survey that asks you specific questions about your mental health. Man Therapy does this in a way that for many men is very approachable because they use humor, but they're very serious about reaching out, connecting you as a man with the help that you need. And Thumb Community Health Partnership has taken the time to upload local mental health resources so that you can find everything that you need right there at mantherapy.org. Another resource that Thumb Community Health Partnership is providing for free is a women to women health and wellness group, Better Choices, Better Health. And it is for women who are experiencing a chronic health condition. This does include depression. And it is a several-week program where you log in once a week, and you're coached by Gail Ines, who will help you to reach your health and wellness goals. And this is being offered for free through the Thumb Community Health Partnership. And I think that these are just two wonderful programs. I don't recall if this is our last slide. I think it is. Okay, great.
Thank you very, very much, Kellie, for that very sensitive, thorough, and informative session. We really appreciate you bringing this to our attention, especially in September, which is National Suicide Awareness Month. Thank you.
Thank you so much for having me, Louise.
And I'd like to invite everyone to participate in our next Healthy Living together. We do them on third Wednesdays. So the next time at noon will be October 20th. And I will happen to be the speaker. Every year in October, I do a Medicare presentation because I'm a Medicare Medicaid certified counselor by Region 7 Area Agency on Aging. I'll be very happy to bring this program to you, and just please call or email Nina Barnett to sign up. Any parting comments, Kellie?
Just remember to reach out to your friends and family. You know, the information I shared today is helpful. Even if someone's not experiencing a crisis, you can help someone to take that first step into reintegrating into their community after a long hiatus, or even taking that first step to their mental wellness.
Thank you, thank you, thank you. Bye, everyone.
Bye.